This is Victor Abafe with A Healthier Democracy. I want to discuss ERISA, the Employee Retirement Income Security Act. Enacted in 1974, ERISA was originally focused on pension fund management, but also established standards for most private sector healthcare plans, particularly self funded employer plans. These plans now cover 64% of those who obtain insurance through their employer. To clarify, self funded insurance plans are those in which the employer pays the health claims directly, assuming the risk for potentially high or unexpected costs. In contrast, fully insured plans involve the employer paying a fixed premium to an insurance company, which then assumes all claims risk and administrative responsibilities. Self funded plans are primarily regulated by ERISA, which preempts most state insurance regulations. Fully insured plans, however, are subject to both ERISA regulations at the federal level and state insurance laws, including state mandated benefits and consumer protections. As a result, ERISA regulated plans are more uniform across states, but also are more flexible due to the absence of these state requirements. ERISA imposes federal reporting, disclosure, and fiduciary requirements on employer self-funded health plans. Employers must provide a written description describing the terms, benefits, and eligibility standards of the insurance plan to their employees. They are also required, on the disclosure aspect, to file an annual Form 550 with the Department of Labor disclosing operational and financial information about the health plan. Most importantly, employers have a fiduciary obligation to manage the plan in the best interests of participants, their employees, to avoid conflicts of interest. Employers or other fiduciaries can be held personally liable for breaches of this duty. ERISA plans also cannot discriminate among employees, with the exception of discrimination on the basis of clear employment criteria, such as hours worked or job classification, in determining what types of benefits somebody would be eligible for. However, ERISA has some shortcomings. Federal preemption limits the use of hospital price caps or drug pricing reforms that exist in some state regulated plans, and there's a lack of enforcement mechanisms regarding price transparency for healthcare services. This can lead to higher spending and greater variation in the cost of medical testing and medical treatment. ERISA also restricts lawsuits to the recovery of denied benefits, bearing punitive damages even in cases of wrongful claim denials by the insurance. Proposed reforms include narrowing federal preemption to allow states to regulate these self-funded health plans for cost control purposes, leveraging fiduciary requirements to mandate upfront price disclosure, and using AI to simplify claims processing. To understand the market for employer-sponsored health plans, it is crucial to understand ERISA and some potential reforms and the ongoing debates regarding transparency, consumer protection, preemption, and federalism.